Welcome back to another episode of LifeSci AI, the podcast series. Of course, in this series, we are focusing on the use of AI in drug discovery. And this continues on this episode. And we are delighted to have the head of in silico design at RxCelerate, Jon Heal, to join the podcast. So welcome, Jon. I'll give a short introduction and I'll hand over to yourself. Because RxCelerate are a biotech that are delivering complete preclinical drug development programs and project management for virtual and semi-virtual companies. And previously to his work at RxCelerate, he was the CSO and founder of ProsaRx, which I'm sure we'll talk about a little bit as well, where they developed a proprietary computational platform for in silico drug design. So thank you very much for your time, Jon. We've got some exciting bits to discuss in this episode, but welcome to the podcast.
Yeah, thanks, Nick.
If you would like to give people maybe a more in-depth and introduction to yourself and your work, I don't do it justice by any means.
Sure, no problem. So as you say, my name's Jon Heal. So my background, I've got a degree and PhD in chemistry from Imperial College, and that was some 20 some years ago. And since then, I've founded two companies in the computational chemistry space, both of which were doing computational, contract research work. And in fact, both of those companies were eventually acquired by larger entities. And through that long history of doing service-based work, I've obviously seen a lot of changes in the industry, and over that time I've worked with over 50 protein targets, and really therefore I've got broad experience with discovery, across different target classes and different therapeutic areas as well. So as you say, currently I'm the silico team leader at RxCelerate in Cambridge, and RxCelerate is a integrated service provider for drug discovery. And it spans a number of different sort of siloed areas of activity, including in silico, in vitro, and in vivo as well. And essentially, we develop candidates based on customer requirements. And there's obviously different groups of people that try and do these things, right? The service companies that will take a brief of trying to develop a drug for you. Our methodology is to try and find what's the quickest way to get to proof of concept. What's the most efficient way of doing that? And in terms of our end of it, computational chemistry end, is what's the optimum set of molecules that can answer those questions the quickest, right? And that's the crucial thing. So we're not looking for the longest program. We want really the shortest program to answer the questions that need answering, and that's how we try and set up. So therefore, if you're going to try and do that, you need a team that's going to try and think on the feet to try and answer the question: what's the optimum, set of tools and processes and procedures that you're going to try and answer the question. And surprisingly, the answers to those questions can be quite different depending on each program. And so our mindset is more of a toolkit approach as to how we try and solve these problems. Fresh piece of paper each time. What's the best approach to try and solve drug discovery problems? And as I said before, you tend to find you come up with quite different answers from different projects.
Yeah, absolutely. And we'll sort of go into the two major areas for this episode is going to be around sort of the platform that RxCelerate have and the proprietary technology around building sort of virtual libraries for it, and what that can mean for the people that you partner with for it. But we'll sort of set the scene first around sort of techniques around chemistry and the difference that the computational methods have made in a short while. But someone in your position, Jon, I guess there's probably different things you could look at in your career now, having had such a strong academic career, going into founding two companies and then now working at RxCelerate. So interesting questions to start off with. What would you say your purpose is now?
So my purpose now is to try and It's to do several things at once, right? It's to interpret the ever-emerging technology and convert that into useful applications to impact on drug discovery, right? Because the science is changing very fast. So there's always a lag between embracing the new technologies and applying them to customers, because that's what customers want. They want to use what's the best approaches for their target. So, but of course, if you have to wait for a software company to develop that into a tool for you to use, then that may take some time, right? There's always a lag between what's interesting in terms of cutting edge science and what actually you can buy off the shelf as computational chemistry software, for example. So if you have a strong research mindset in your team, however, you can actually implement a lot of what's coming off the shelf and through the research into actually translate it into useful applications quite quickly. So a lot of my work is actually trying to do that, facilitate this R&D to move interesting technologies into reality and applications for customers. That's really a lot of the focus. But then, of course, managing many different client projects at the same time is also then part of the job.
Yeah.
And this is often the interesting thing with computational chemistry, is that you often have projects which are very sort of staccatoed in nature. You have a very intense period of work that you may not do very much for a couple of months, and then it will come back and you'll be another intense period. So you have these cycles of intensity which play over a number of different customers.
Yeah.
And so of course, in terms of then managing the team with that in mind, you then have to figure out how you manage that kind of throughput and intensity to match, alongside doing all the R&D that makes sure you've got the best tools when you get there at the same time. So it's all of that.
Yeah. So a lot of plate spinning for yourself. Where does the connection between putting new technology into sort of the people's hands to initiate the advancements in science, where does that innate passion come from?
So for me, it's really based on experience. That there's no one solution to drug discovery. There's no when we've worked on different projects in the past and had it's only when we've applied a certain set of tools and approaches to a project that we found the right solution. And we find, and it's somewhat annoying this is the case, but the more effort and the harder you work and the more angles that you attempt on a project often leads to better results, right?
Yeah.
So because of that, it means there's no shortcut for doing drug discovery often. And so, and I think it's that experience then, that if that's the case, then it also then follows that there's a feeling that you need to have the best tools available in order to try and solve the project in the best way. And that because the science is changing, science is always changing quite quickly, or the technical development is changing very quickly around you. That's where the appetite comes from to try and implement the best tools at the kind of immediate time that you want to use them.
It's fascinating. We kind of started, or definitely asked every guest in the series so far around their purpose and what connects them to the everyday role and what you're looking to impact from a end client point of view, from a sort of end patient point of view, from an end scientific advancement point of view. So that's a little tidbit, but I guess it's an insight into your motivations in your mind and also how busy you are. So all right. So just before we sort of go into around the platform and the proprietary technology for which you guys are really promoting and famous for RxCelerate. So what was chemistry like in the 80s and 90s? Because you said around prefacing the direction of travel and to set the scene, as it were.
Yeah, so I mean, historically, the industry was became sort of transformed in the 80s and 90s through hypertrophic screening. So this is where you have a physical collection of 500,000 or 1 million compounds. In some places, even more. Stored, ready for assay. And so, and the belief was that the more compounds you test, the higher your number of hits would be, right, for any given project, and that would work for any target, and therefore that's how people proceeded. And it was really that was the sort of mantra that chemists really were in charge of the project. Hits came from screening, and then they would lead to chemistry programs. And from a sort of computational chemistry point of view, it was very much a support act to help people understand hits as they came, and maybe apply it to structured a situation where it was possible, but it certainly wasn't a given, and it certainly wasn't driving programs back in the 80s and 90s. And I think where we've come from there is the realization that chemical space is obviously much larger than 1 million compounds, and in fact, in some senses, it's almost infinite. In some way, it is actually technically almost infinite, but practically, based on what you can easily make and search through, it's still into the trillions plus sort of size, and that's conservative. So there's a sort of growing realization that chemical space is much bigger than the sort of sizes we were searching in the 80s and 90s, and therefore you need to find good computational approaches that can help you search that space in order to identify better molecules, which is a really simple idea, but it's been a powerful driver of how the technologies have been developed over the last 10 years or so to try and address this need. And there are companies which have been very much at the forefront of promoting these larger libraries, and so companies like Enemy, for example, have developed these large databases called the Real Collection, with billions of compounds in them that are all synthetically accessible compounds which can be made on demand. And so the idea is that you can find a method to search these large libraries, and then the chemistry companies can then obviously provide the ability to synthesize those molecules for you as a service. And this has become the almost standard way now of looking at projects, whether these large libraries can be incorporated into searching for target, on the basis that we are more likely to find a useful hit in a larger library than a smaller library. in concept. But there are, I think, many significant issues still around these larger. Just the presence of the library itself doesn't give you drug discovery, right? It just gives you a lot of compounds to look at, so you still know what you're looking for and why. And this people use the term search. I'm searching for a compound, but the word search belies many different ideas. Right?
It hasn't really got an end to it, searching, has it?
No, we think we know what we're looking for in some respects, or we think we know when we found what we're looking for, but often that's just the start of the start of the journey here. So there's the sort of what's happened in the industry, then the change has been this growing awareness of the fact that if there is a technical capability to search larger spaces, and if we can search those larger spaces, then we're more likely to find useful molecules, and then you get all the attendant technologies around searching large spaces. Right way. I think a lot of the issues though come down to the starting information that you have for a given project can vary dramatically, right, between a project. So it matters considerably whether you're starting from a well-known protein class with a drug already bound into it, or a ligand is already present and you're looking for something new, to a ligand-based project where you've got something that's got phenotypic activity, you don't know how it's working, to where you have an interesting protein interaction which has never been drugged before. and you're searching for something new in that type of situation. So, and I think a lot of the talk is about what technologies and approaches can be used to solve this general problem of searching, but actually where you start in that configuration of the different projects completely then dictates the types of technologies and approaches that you will use and the likelihood of them working in each case. And so, for example, the enemy libraries have been very well used from a sort of ligand-based similarity search. It's very easy to search to start from a known screening hit, for example, and to ask simple questions like, what's the most similar molecules? And like I say, that belies many different concepts to that within a library of billions of compounds. You can do that search pretty quickly, but it's a very low information search. So it's the answer is low information in that respect. You can do the search, but you're not really answering questions about how the ligand is binding or what it's really doing. You're just measuring similarity, for example.
Sorry, Jon, I don't know, your sound we just lost on the mic there for the last sort of 20-30 seconds of that.
Oh,
do you
right.
mind that? Sorry.
Yeah.
Kind of like you're almost drowning, but you're not. I can guarantee you're not drowning.
Yeah. Sorry about that, Nick. Yeah, so the where you're starting in drug discovery, the exact situation that you're dealing with dictates the type of approaches that you will use, and if you want to search a large library and it's just searching against a simple ligand for similarity, then that's a very, very easy thing to do, and you can use large libraries to do that on the internet, for example, and there's no difficulty doing that. But however, if you want to search for a new protein-protein interaction inhibitor and nobody's already drugged that interaction, then that's a completely different situation and is much more difficult, and you're then dwindling in possibilities of how you might solve such a problem with current technology.
Yeah. Okay. And so that's sort of the setting as it were, and I guess is that the kind of not problems, but like that's where the challenges and the scenarios in which you face the people you partner with to enable them to have this sort of proprietary technology around the new libraries in which you guys are creating.
Yeah, precisely, Nick. So we wanted to develop a solution which would tackle what we think are the hardest problems. We're not trying to tackle them because they're hard. We're actually tackling them because they are, very useful things to do. Right? They're hard. So what happened is that because in I guess going back to the 80s and 90s in comparison, there were various protein classes that were very familiar and well drugged. Things like kinases and GPCRs and ion channels and proteases. So very familiar sort of drug target classes. And with those classes, you have a lot of information as to how the drugs work and where to start from and all those sorts of information. So empirically, you send up start quite information. What we're looking at increasingly more now is new and novel protein interactions in systems. So these are, because we have now the ability to generate accurate protein models for a huge repertoire of the whole proteome, in effect, human proteome now, and interaction partners. It's led to this explosion in interest in drugging new protein interactions that people think are therapeutically relevant. And this really is on the very hard end of the spectrum of what you can do from a computational chemistry point of view. I mean, if you don't have an ability to do a high throughput screen or something, or some physical screening in that situation, and you want to only do that with a computational approach, then that's a quite tricky thing to do. So what we wanted to do is to come up with a methodology that would allow us to address this problem. And we came up with this idea of using hierarchical docking through virtual library space in protein interaction, sort of binding pockets, and using that a way of tackling this problem.
Yeah.
So traditionally, the bridge from
I was just going to ask, why did you choose that approach, and were there other approaches you were considering in solving that problem?
Yeah, so the interesting thing here is that virtual screening is the sort of bridge between high throughput screening, which is the physical version. Virtual screening has been, used in the industry for the last 15 years or so, and has gained sort of prominence as a useful approach. So it's not something that is known. Practitioners in the industry will know that it's not something that has had a strong history of delivering high hit rates in every case, but it's certainly something useful in the toolkit that most companies will now embrace and use. Where a protein structure is available, they will utilize virtual screening in order to help their discovery campaigns. But traditionally, it's only really focused on commercially available ligands that are to purchase off the shelf, which tend to be, somewhere up to 10 million in strength, rather in the billions or trillions, because there is only that kind of number of ligands that you can purchase reliably from around the world. So this is the technology which people have used over the last 15 years. We've certainly used it a lot, and we've got many good success campaigns on this basis. And I think the challenge then is to take that type of technology, which has been shown to work, but tweak it to make it more efficient, so that it can be used for billions to trillions of molecules, and then also tweak it to work for situations where it's not been for protein interactions that have not been drugged before. So there's really compound challenges within trying to do that using this technology. And what we are trying to do is to find good solutions to this problem. There isn't a really good solution to that problem, which is why we try to invent one effectively. Knowing that it's challenging and that it's going to take some work to get there, and you're going to have to try it out, right, and see how you do in order to solve the problem. But there isn't really a good solution to that problem we currently stand, which is why we wanted to develop one.
So there's not an ideal solution, not a good solution. Where would you say your solution is, and how successful has it been? But also, on a follow-up question to that, what do you think? How far can it go?
Yeah. So it's kind of, so we're ranging, and it's scoping what you can do. And I guess the fun thing in drug discovery is that the best way to do these things is to try it out, right, and to try things out. So our approach is that in order to build virtual libraries into a protein, you have to be very careful that you do it in a way which builds on solid information as you go, right? So to try and put this in a sort of simple context, the main problem that you have with doing anything, searching compounds, large numbers of compounds, is you have to estimate at each stage the compound's affinity to the protein, its ability to bind to the protein. The problem is when you start very small, or we start with a very small piece of the solution in the protein, the error bars are quite high, right? So where you start from in this process is this, you have a problem of noise effectively in your solution space. And so our approach is to really try and reduce that noise as much as possible, so that as you start to build up compounds in the protein binding site through a reaction scheme, that you actually build as much certainty as possible into each round. And actually, is if you focus on the effort in the beginning part of the scheme, then it's less likely that you're going to have to be so certain as you go through the scheme, then, because you've built something through higher probabilities earlier on. So this is just a sort of conceptual exercise of how you would do this. But you can imagine then starting with a protein binding site and choosing 1 million possible small fragments that will bind to it. If you're certain that you found the best 20 to start the process off, then you're much more likely to then build the next library of 10,000 or so based around those fragments if you're so certain to do that. And that's been our approach. The other thing we've built into the system is the ability to go back. So what you see in virtual libraries, or for example, the enemy real space, is that the library is fixed, right? So they have you enumerate the whole library, and you're then searching this fixed library of space. The space is definite. In our case, what we're doing is we're saying, here are reaction schemes which in-house chemistry are like, that are acceptable to chemists. How do we traverse these schemes, but knowing that we may need to go forwards and backwards? So it means that you're building up the solution space, the chemistry solution space, but you've actually been able to, you have the ability to actually then, once you've optimized a certain part of that protein interaction, as it were, you can then also then go back and optimize where you started from as well, eventually.
I see.
So it's this dynamic ability to search the space that creates the much larger chemical space than you could do if you statically said, here's the library, right? And so it's that dynamism in the algorithm which provides that basis.
I guess it goes back to what we were saying at the start as well around what does it mean to search. You probably have a very different meaning of what it means to search than someone else maybe does now or definitely did 10, 15 years ago. Search becomes a different thing for you guys than it did previous.
Yeah, that's exactly right. There are so many different aspects to it, and of course there's also the concept that each target is different with very different requirements. Some proteins are very mobile. There's a lot of movement there. Some proteins are very open and solvent exposed, in which certain water molecules are crucial. And so there's so many details of each system that you have to get to grips with in order to get this right each time. And so what our approach is really says that it's more of a, although we sell services that do this drug discovery, it's actually a toolkit mindset here. That we will apply. We have these algorithms that can do various tasks. We will apply the right combination of evaluations and filtering processes in order to try and find the best ligands. And that will probably be different each time.
Yeah.
But the major stumbling block for all of this, and in general in computational chemistry, and we still haven't moved the needle that much here, is on affinity prediction. And on affinity prediction. So in terms of predicting the potency of molecules against proteins, whereas there have been transformative changes in protein structure prediction through AlphaFold, and in certain other areas, we can now do generative AI design as well, which is a separate sort of conversation about how you can generate molecules. The ability to actually score molecules against the protein and know which are the best ones is still somewhat behind, and there's not huge advances in the field in the same way that you may have seen things like AI impact structure prediction. So this is where now this is still a major challenge, and it's a bit like imagine you had an old telescope and you looked at the sky and you could see a certain number of stars, and your goal was to try and find stars that might support life effectively. So you wanted to start looking at the stars and start doing some experiments. By going to large virtual libraries, we've now really upgraded our telescope, so we are able to see now a much fuller sky of stars. The problem though is, how do we pick still which are the best ones? So we're now able to have a lot more things to choose from. We still do also effectively rank the stars for their ability to support life, and so we still got the same challenge there, but just with more stars. So what we're looking for is really the ability to know which of those is the correct, the correct stars, or in our case, the correct ligands. And affinity prediction is still a very difficult task on new protein systems. So systems where we don't have any empirical data, any existing interacting ligands in order to calibrate from. It's still a hard task, particularly if you're trying to search through billions of possible ligands. In order to search complex physics about speed is a massive challenge. We still have that challenge, and everybody has that challenge. And a lot of what's been talked about in our field in so-called generative AI is the idea that you can generate molecules from algorithms, and we play with these in our research as well. And you can generate millions of molecules quite quickly, which may struggle with tractability sometimes. But the main stumbling block is still this affinity prediction. Potency. Which molecules will actually bind is still the main problem facing in many of these systems.
And that'll always be a challenge, it seems, because we've chatted on this podcast around generative models and how that can come into the piece. But if you don't have the first bit, it kind of doesn't matter what the second bit is going to be for it.
Yeah, and it's a problem, and it's a challenge in effect. And I think it gets better in systems where you've already got some data, right? So if you've got maybe you've got some data informed by a high throughput screen, or you've got you've already done some virtual screening, so you've developed some data, then it can obviously help and inform what you're doing next.
Yeah,
to build that into machine learning. But in cold cases where you've got just a brand new protein interaction, you're not even 100% sure it's druggable, but you're starting on that journey. Then it is a challenge, and it's one that AI has not solved yet, or any approach in that way.
Yeah, but we have always spoken about, ever since I started podcasting around AI, is the difference between assistive AI versus AI that can take people's skills, take people's jobs, and one thing that I really wanted to discuss with you was the ever-changing place of teams. And sort of what the skills creation are now versus what they were 10, 15 years ago, and what they might be in the future. But I don't know if you have this number to hand, Jon, but just to give some premise of sort of your, I guess, authority in this area, do you know sort of how many people you might have hired indirectly or directly in your career? Or can you give us sort of a rough number of
Probably, yeah. I mean, to be honest with you, I've always worked in relatively small teams.
Yeah.
So it's probably under 50, 60 hires, I'd say, something like that. Maybe this and that. But computational teams now are, they don't tend to go too large, right? So you have 5 or 6 people, probably up to 10 in large organizations.
Yeah.
Tends to be.
But 50 or 60 in this space is relatively large.
So, in aggregate, yeah. Over a career, I guess, yeah.
So what have you noticed let's sort of do as we did the directional travel around libraries? What would you say the difference is between the skill sets of people you're hiring now versus 10 years ago, perhaps?
Yeah, that's an interesting one. I mean, I'm guessing, everyone we talk to now has played with some AI type of approaches. Sometimes as a hobby more than as a career based choice, but there's certainly a greater exposure to various AI-based techniques, machine learning, and certainly some statistical background as well would be typically what people are exploring, often as an adjunct to their main skill sets. I think the other major change is that obviously GitHub and the ability for repositories to obviously people will get used to exploring repositories as just the basics of their job, and that that's something that's really emerged over. Most CVs now will have somebody's GitHub related data and information on them now compared to where we were before, where it was a bit more difficult to sometimes assess exactly what they've been working on, or examples of their code, for example.
Yeah. And how has it changed in terms of, you know, the hard skills of 5 years ago versus the hard skills that maybe can be done by automation now, because things have adapted? You know, looking at my own career in recruitment, there are things now which I had to do 4 years ago by hand, which are now fully automated.
Yeah.
And that completely changes the kind of even we hire. So how's that affected your particular hires?
Well, I think in the future, it's going to change things. I mean, everything is now on the move. So, you know, many people have discussed the emergence this year of the large language model approaches, such as OpenAI's GPT-4 and Google's Bard, and this is going to disrupt many industries. It's not just promising to disrupt; it will disrupt. And you know, drug discovery is no exception to that. And you know, I think in computational chemistry, we certainly can now imagine a world in which we have co-pilot agents eventually, which will help us complete, you know, tasks faster with higher level commands. Over large data sets, for example. I mean, right now these agent type approaches aren't yet implemented, but you can already see from examples on GitHub and coming through literature that it's not going to be too long before this type of technology is available. Exactly where it's useful and how it's useful will always be something to evaluate, but you can think it's going to change the direction. So then it means that for those of us trying to build a computational chemistry team within drug discovery, you know, we have to stop and reflect on how that's going to sort of change different roles in the team, because there could be brand new roles in the team that this allows. Not just how does it change in any individual job, but what other jobs does it then create? Because, you know, normally if you want somebody that's good at doing data science, you have to hire somebody that's got strong coding data science background. But of course now it might be possible that we can perform a lot of the rudimentary tasks, and you know, even some sort of basic machine learning and so forth from somebody with, you know, little or even no programming experience now that can do that. So it's got then the potential to disrupt the sort of chain between levels of experience and capability.
So is that, as you've probably been through different technologies or approaches that have disrupted the industry, is there things that you are thinking about and processes maybe that you put in play now, or internal conversations to make sure the disruption for you and your team is a positive disruption and not a negative disruption?
Yeah, I think it's really having an open mind, I think, is the key thing. So that in the future, one of the key skills, it's not going to be your exact, you know, programming combination skills or even the exact areas that you worked on, but more a sense of adaptability to change. We're all going to have to be able to adapt a lot more than we were before. So I think that's really the crucial thing, is trying to figure out what that looks like. You know, we're going to need to adapt, and I think that can be a positive. I think it's going to be a positive thing. It will mean that we will be working faster and having more help on manipulating data sets faster at higher levels. For example, is quite exciting. You know, we spend a lot of time moving data around and getting it right, and a lot of heavy lifting involved in our industry. You know, if you think about screening billions of compounds and all the data that generates, and then trying to assess it all, and you know, and so there are a lot of tasks here which, if we can allow, you know, create processes that can manipulate data at a higher level commands, it will free up then that activity to do other things. So the key thing here is collaboration. You know, it's to have probably people that focus more on collaboration as a team rebalance, you know, focus, rather than just focus purely on their technical skills. And of course, collaboration is where drug discovery works.
Yeah.
Drugs are discovered by a team of collaborators, not individuals. So if this technology, the result of this technology is that ends up people collaborating easier and faster at higher levels, then that should, follow that it'd be easier to develop compounds.
And I guess as well, it allows for new ideas to come into the industry as well, and new backgrounds. And on the weekend I was listening to one of the high performance podcasts episodes, and they were talking around building teams with cognitive diversity, and where you're talking about certain tasks being automated and sort of the rudimentary programming tasks being automated, which sometimes can be a barrier to entry for certain individuals to get into either technology and definitely into sort of the more nuanced technology and science in which you work within. So there could be a really exciting ability for people to come in without that barrier to entry anymore, for you able to create more cognitively diverse in terms of experience, viewpoints on life, viewpoints of problem solving, so that the collaboration which you mentioned there could be ever more exciting and ever more varied and different to find problems, to find solutions to these challenges, right?
Yeah, I think that's absolutely right. I mean, it's an exciting future. In some ways, we've been, if you look at that positive, you can then reflect on the fact that we're probably hamstrung slightly by the requirement to have all these coding skills, right? It limits our team composition by having to have people that have got all these certain skills in place in order to do the job. I think that's always going to be the case. I don't think it's going to be a case that it's not a choice between somebody with 20 years Fortran experience or somebody with this new AI, enabled capability. I think the great thing here is that you can put both together, right?
Yeah.
You have a combination of people that have got this high level kind of capability, plus all this experience and depth in code bases as well. So yeah, there's an interesting blend.
That's what you're saying about like new jobs being created, right? For people around the disruption, and how can that affect it positively, and can you think outside the box around your hiring, around your skill sets to inform better collaboration, to have cognitively diverse teams, to be less of a closed shop as it were, because the previous requirements are no longer needed, but they can be picked up in certain automated ways. But I must say there's lots to talk about. I can before we got on the podcast about this before, so there's a ton to talk about further. So I would absolutely welcome anyone to follow up with you, Jon, if they want to talk more around this, and someone who's hired in this space, who's built teams in this space. You could offer a lot of good authority and good input, I guess, in terms of the narrative of what could happen. So just for that, people do want to follow up, what's the best way to reach out to you?
Yeah, so I mean, email is the traditional one. Jon at RxCelerate.com, very simply. It's probably the best methodology. But we have obviously company website with all different accesses through there as well.
Awesome, brilliant. Well, thank you very much for joining us on this episode. It's been absolutely fascinating, and but yeah, thank you very much. Hope you enjoyed listening, guys.
Yeah, thanks a lot, Nick. Thanks for inviting me.